posterior sag sign. So bend this knee for me. So for posterior sag, you're basically just looking to see if the tibia shifts backwards or like downwards towards the femur. If it were, it would be positive. In this case, it's not. If it was positive, it would indicate an injury to the PCL as well as the arcuate ligament and the posterior oblique ligament. Next is Godfrey 90-90. So bend both your knees like that. So here you would just stabilize them in this position and just look to see if the tibia shifts downward towards the femur. If this were positive, this would just indicate a PCL injury. And then next is posterior drawer. So having your hands around the proximal tibia and pushing posteriorly. If this was positive, there would be a downward shift in the tibia towards the femur with no endpoint, and this would indicate a PCL tear. Next is valgus stress test. So you would do it once at 30 degrees and once at 0 degrees. If this was positive, there would be joint line openings at either 0 or 30 degrees. If it was at 0 degrees, it would indicate an injury to the MCL or the PCL. And if it was at 0 degrees, it would indicate an injury just to the MCL. And then last is the Vera stress test. So same thing, 0 and 30 degrees. If this was positive, there would also be joint line openings at 0 and 30 degrees. And if it was at 0 degrees, it would indicate injury to the LCL and PCL as well as possibly the arcuate ligament. And if it was at 30 degrees, it would just indicate an injury to the LCL.